Have you ever felt a sharp pain in your upper abdomen, usually on the left side, and sometimes it radiates to your back? That pain could be caused by many things, but one of them is pancreatitis, and that's what we're talking about today. Welcome back to RN Info, the place where you get clear, reliable information on health topics. Today, we're covering pancreatitis, what it is, the types, the symptoms, treatment, and management. And as usual, there'll be questions at the end to see how much you've retained. Let's dive right in. What is pancreatitis? Pancreatitis refers to inflammation of the pancreas. The pancreas is an organ located behind the stomach, and it has two main functions. One, producing digestive enzymes to break down proteins, fats, and carbohydrates. And two, secreting hormones like insulin and glucagon. If you remember, we talked about the pancreas in our diabetes video, so be sure to check that out. Now, let's look at the two types of pancreatitis, acute and chronic. Acute pancreatitis is an abrupt onset of symptoms, while chronic pancreatitis is a long-standing disease that continues even after the original trigger has resolved. Chronic pancreatitis is characterized by scarring and irreversible destruction of the pancreatic tissue. The main symptoms of both are usually pain, weight loss, and issues related to loss of functional pancreatic tissue, such as diabetes and malabsorption. Now, let's look at acute and chronic pancreatitis separately. Looking at the causes and symptoms of acute pancreatitis. The most common cause in adults is gallstones, with alcohol coming in as second most common cause for acute pancreatitis. Less common causes include viral infections, trauma, and manipulation of the pancreas during surgery. However, in about 15% of cases, the cause is unknown. For symptoms of acute pancreatitis, the main symptoms are nausea along with pain in the upper abdomen or back. These symptoms can come on suddenly and range from mild to life-threatening. Mild cases usually would resolve within about a week, while severe cases can lead to major complications like infection, hemorrhage, organ failure, or fluid collection in the abdomen. Okay, now let's look at the causes and symptoms for chronic pancreatitis. Alcohol abuse accounts for about 75% of chronic pancreatitis cases. Less common causes include hereditary pancreatitis or pancreatic duct obstruction. A key feature of this condition is that irreversible scarring of the duct and the functional glandular tissue of the pancreas. This leads to an inability to digest food properly due to a lack of pancreatic enzymes. This is known as pancreatic insufficiency, and it also affects insulin production. For symptoms, the primary ongoing symptom is pain in the upper abdomen that radiates to the back. This pain can last from hours to days and may eventually become continuous. Eating often makes it worse. Okay, let's look at diagnosis and tests for both acute and chronic pancreatitis. For acute pancreatitis, a physical exam may show tenderness in the abdomen. Blood work will often reveal an elevated amylase level, amylase being a digestive enzyme. A CT scan or ultrasound may show swelling or damage to the pancreas or fluid collection around it. For chronic pancreatitis, patients usually already have a previous diagnosis of acute pancreatitis, along with signs of malnutrition and weight loss. A CT or ultrasound may show inflammation and calcification of the pancreas. Though amylase levels may be elevated, they are less reliable as a marker in chronic pancreatitis. Now, moving on to management. Most people with acute pancreatitis have significant pain, nausea and vomiting, and typically need to be admitted to the hospital. So, treatment focuses on managing those symptoms, which includes IV fluids to replenish what's been lost and prevent dehydration, electrolyte replacement, since electrolytes are often lost through vomiting, and pain medication to help manage discomfort. Patients are also kept off oral food to avoid further irritating the pancreas, and any complications that arise are treated as needed. If gallstones are the cause, the gallbladder may be removed once the pancreatitis has subsided. Symptoms usually resolve within 4 to 7 days, after which it's typically safe to resume eating. Now, for chronic pancreatitis, management focuses on two main issues: pain and pancreatic insufficiency. Pain is managed with analgesics and narcotics, though caution should be used with narcotics as they can lead to dependency or addiction. Nerve blocks may also be used along with lifestyle changes like stopping alcohol consumption. For pancreatic insufficiency, a low fat diet supplemented with fat soluble vitamins and calcium helps support nutrition. Enzyme replacement therapy, such as creon, may also be needed to ensure adequate digestion. If diabetes develops as a result, insulin therapy is usually required. Now, that brings us to the end of the main content. Let's go through a few questions to see how much you've retained. First question: what characteristic is the defining feature of chronic pancreatitis that distinguishes it from the acute form? The answer is irreversible scarring and tissue destruction. Second question: in adults, what's identified as the most frequent cause of acute pancreatitis? The answer is gallstones. And lastly, which laboratory finding is a common indicator of acute pancreatitis during blood work? The answer is elevated amylase levels. That brings us to the end of the video. If you found this helpful, please like and subscribe, and I'll see you in the next one. Thank you.